go.
Okay, great. Today we have a special event. It's a demonstration and presentation of bioenergy medicine for the lovely circle of friends of Christy, the first certified specialist in Kevin's Wellness Center. And I'm so glad, guys, that you found the time. My name is Natalia, and I'm initiator of the All Ideas of the Bioenergy Medicine Bahamas Wellness Program. Thank you so much. Each organ in our system active for 2 hours, and they change. That's how they are transmitting the energy with the 5-element system, right? It's a cycling, and if it's distracted, then it's not reproductive, it's destructive, and that's how we actually affect and change the even anatomical structure of our organs. So because of these colors, you can do the diagnostic, and we teach that diagnostic by the color of the face, eye, and the color of your tongue. All of that you can learn in our program. Good. So let's see what our guinea pig Paul will share with us about the sensation. Good.
Yep.
Let's start through the ionic silver gloves, right straight to the meridian network or pathways that I would not receive them, and I will transmit it to a client. However, I can do treatment to myself using the same set: surgical gloves and ionic gloves. I can work on me, except I cannot work on the back. The principles of the opening the all 12 meridians, right? But we can work shaping, we can work particular area that has a current pain syndrome. So it's as a self-therapy as well as a giving to somebody therapy. So we're starting with applying as a special type of moisturizing cream over the torso, because on one display you would see all the organ projections we can observe here. Well, I no wonder that he has a high blood pressure. You see, if you would like taking a picture, and I will tell you something here that you for client use, because then they feel more confident and they will be sure that the elevation or increasing of the intensity in their hands. Today for the demonstration, Christy gonna help me because we're gonna work in a very low level as he has a high blood pressure, right? So we go till 10. So nice to work together. So I check myself if the energy is running, and then we touch a client. Now tell me please, Paul, is any sensation you feel now? Like tingling, vibration? What do you feel?
He's asleep.
Yeah, it feels very good. You don't have to stop. Just keep going.
You feel it, right?
Yeah.
Okay, good. Right, and on Huntiao we're going to increase 4 points up. Do you feel the difference?
Yes. No,
What do you feel?
It's tingly feeling. Feels like it's kind of opening up my muscles in a way, or kind of
Good. So go back to 10, and I'm going to explain. First, we open central back meridian, because through that spine canal, everything is managing in the body. Through the peripheric nerve system, activating central and the peripheric nerve system. So start to increase 2 points. Do you feel the difference in the area of your belly? Good. How profound do you feel it?
The tingling has increased. Vibration. It feels like vibration is kind of moving around my muscles a bit in the inside of my hip and.
Good.
Can you do that on my back too?
So because we're talking, I would like you communicating and participating in the process. Now we're not talking to Paul, we're going to employ him to do the breath motions. Okay? So now inhale. And exhale through the nostrils. Easy, not forceful, because your breath also helps to pass the energy with the rhythm of the diaphragm motion. 4 points up.
It's on 14.
Good. Keep breathing, deep inhalation and exhalation. One more time. For the medical professionals, I would like you to see simplicity how we set up whole openings of the meridians. The only our method allowed to open 15 meridians. Needle therapy, acupuncture point can work at 6 maximum meridians at once. We open 15 at one session. Keep breathing. Inhale deeply, easy, no force. And exhale. Go up. Simple motion of hands over the spine meridian or central back meridian, ending up in sciatica points, which we have a Chinese names for all the points. I'm saying you cannot tell the clients because they don't know the difference. Only to the students or specialists we use those terminologies. So don't worry about that you might not learn the Chinese points in the body. As soon as you learn the hands motion, understanding what is actually happening inside, then you can practice minimum on yourself, maximum with your beloved one family members, and you can make actually a good enterprise. Has no competition yet in the Bahamas. And my target is eco wellness tourism, to convert these nice resorts into the wellness tourism in the Bahamas. So become the specialists. We need you. Breathe.
Is he still feeling tingling?
Yes.
Yeah.
Are you?
Yeah.
Good. Now for the next 2, pass over the spine line motions. We're going to increase till 12, and Paul will give the comments. Now, Paul, there's 2 more points on the intensity. Tell, how do you feel it? Do you feel the difference?
Yeah, it seems wider. It's coming down the spine.
Right.
But the intensity feels about the same.
Rising up.
Now it's a little.
Till 16.
Yeah, that's higher vibration there.
16. Breathe in.
That feels good on the lower back.
It's a very nice sensation. I like the energy refills you up right strong. You pick it up and then you eliminate it. The body capable to eliminate that. Sciatica. Good. 18. So you feel that?
Yeah, it feels good. Right
Good.
at the tailbone.
Gradually we increase if we would like to get the faster results of the acceleration. And again, we do not stimulate, we revitalize. It's like you have a dead battery and you cannot start the engine, and then you need to get the jumpers. Well, this is maybe like a jumpers. You feel more vitality in the body, and suddenly it starts to run on the optimum rhythm. One more time, collaterals.
10, 12.
12. Okay, let's see how Paul's body going to feel. 12 points. It's a quite nice, profound. Keep breathing. Good. Boom. You see? Boom. What are you waving to? 12.
Yes.
All shoulder blades goes to armpit. Open up lymphatic drainage and energy through all length to the fingertips. If you notice that martial artists, it's not much of the physical hit on the wall or some defense. It's the energy that comes out through the fingers. That's how the body functions. So for the detox, we employ that capacity of the physical body construction to remove pathogenic factors or disbalanced energy, which is invisible toxins, like free radicals. You cannot see them, but definitely the body behavior and the condition, physical condition, tells about it. So we're opening again waist meridian. So pretty simple motions, as you see, but this whole technique was assembled by almost 100 specialists of the traditional Chinese medicine that works for the Science Research Institute that we own as a transnational corporation. All the research we have done, so was tested clinically, and of course, a lot from the inheritment of over 3,000 years, according to traditional Chinese medicine history. I'm not talking about the Ayurveda, which is even when the ligaments start to pull muscles, then you suddenly see the twitching, tingling right on the surface of the
16, do it up 2 more.
Yeah, one more. You feel that? And I feel that.
feel
When
the
I reach
tail.
the right level, then I talking to the body, and that means that the meridians are more effectively opens up and cleans. Okay, great. So after we accelerate the central and peripheral nerve system, because it controls the whole management of the physical body, we start to deal with the lymph, opening bladder meridians. 10. So it's a completely different sensation. You see
Oh yeah.
here.
My muscles are moving for sure. It feels like they're kind of pulling
That's
towards each other and away from the outer part of my body,
right.
closer to the inner part. Kind of like they're coming together wherever your hand. Is that your hands?
Yeah.
Yeah.
Start to increase.
11,
On the coccyx bone, balau. It's a special
13.
type of.
14, 15,
Oh, that feels good.
16.
Okay, on 16, breathe in.
Yes.
Sometimes you even feel like butterflies. They're
good.
very pleasant feelings. And all of our therapeutic methods based on pleasantness, even though it might be intensive, but not to hold the breath and thinking, oh, it hurt me. We don't practice anything that might be unpleasant or hurting. That's the principles what we do. Even our naturopathic therapy or remedies, they all food grade and very tasty. It's really like a source of the food, but more concentrated.
It's 10.
10, okay. So you see, we're going over the bladder meridians, 2 lines on each side of the spine, and we accelerate all body liquid flowing, plasma, lymph, and blood, of course, circulation. Increase, keep breathing, deeply inhale.
16. You want me to go up 2?
No, one more. Exhale. Inhale.
Do you adjust it according to the thickness, the body set of the interval?
Yeah, everything plays a role. The thickness of the muscles, also sensitivity are very important blockages, because when the block, the sensitivity is not there. So, but 1, 2 strokes over, it opens up, and suddenly you hold for 2, 3, 5 seconds, no response, and then on the 10 seconds start to tweak. So that means body corresponding to 10 to the energy flow. Basically, we don't do anything artificial to the body. We're just helping to reestablish communication with the energy, positive and negative, yin and yang, through the pathways. That's what we do. That's why we have a special charts and special sequences to open gradually each part of the body to work more effectively. Effectively for what? For self-purification, because that's your born function. We do not install in you, you have it, but it's dysfunctional. And then self-healing. You also have that, but
Still.
it doesn't work.
So
Okay.
10 or 12?
12. Now we're going on 12 and you will see his response. Now you see the toxins? Up to 4 grams, these gloves capable to suck through the body, through the pores, the toxins from the body, through the capillary circulation. I'm gonna wear the gloves because his body is balanced. Temperature dries them a little bit faster. And we do it all the time through the session because body is a liquid and the correspondence of the waves and the energy goes through the water molecules. That's why it has to be in the liquids. So breathe in and breathe out, and now we're gonna feel a little bit more profound. You see that? And it's not hurting. His body spontaneously responding to that, not mentally. You feel more profound, right?
Yeah, I feel
Because-
my abs, my belly.
Yeah. Because now we go over the soft tissue. First we open it, the spine canal. It's a bone, it's a spine. Here it's a soft tissue, more sensation. And sometimes it's so pleasant because body likes it. And now the body talks to your brain and suddenly everything starts to correlate and settle on the right path. And people in a 2-3 session, they become different people. Okay? So, and one more time. Now, I would like you to notice there were pimples more pumping out, right? You see, they get flatter. What was there? There was accumulation of the waste and toxins to pull out from the body. So it's not even doing the dermabrasion or scrubs, it cleans out. But where is it? There on the gloves. Inhale. And can you imagine that this will do the work on the face skin, in the gloves, and with ultrasound? Just need the time. Increase. We run too fast, and we have to love ourselves better and give more time for self-therapy and self-maintenance.
17. You want me to go to 18 or leave it at 17?
Let's ask Paul. That's
Paul.
what we do. We talk to the client.
You want
Would
it
you
up
like to
again?
experience more?
You can go up a little higher.
That's one more. Another one?
What do you feel?
So it feels like a vibrating massage. Instead of pressure in the body, it feels like it's happening from the inside and working its way out.
But it's not mechanical vibration. There is some vibration guns, right? Or massage tools.
Right, yeah.
And this is because of the energy. It's the nature of your body energy, and it's vibrating, and that's what we call bioenergy resonance therapy.
Yeah, it feels like a vibrating massage.
Yeah. This is the topest technology today on the wellness market. Good. So now we prepare the whole body, accelerating the whole management through the nervous system and lymphatic drainage, everything very active inside of the body right now. So we're going to expel more energy, we call it collateral, from the center to the
10
approximate
or 12?
10. Stiffness that you might have. Increase 1. You see? Increase 1 more. Good. Now watch his hands going to move spontaneously. Booms. He doesn't do anything. That's the energy
You
move.
can see his fingers.
Okay. One more time. 10. So that's how power of the stream on the flow of the energy affect the healing process or restoration. Increase 1. Good. So I feel him now because he is talking to me. By hands, I feel his response. When you practice that, you start to read your body and the client body. Your husband body, your wife body. You see much better. Can you imagine you treat yourself in the morning, in the afternoon, refill the energy and go and go and go for the positive, not to exhaust yourself. Now watch what we're going to do. We're going to do armpit, opening 6 pathways on each arm. And here you're going to say something. What do you say? What do you feel?
Anything?
In
No.
these two? Where do you feel the energy?
It's coming from my underarm to my hands.
Right on the
To
fingertips.
the fingertips, yeah.
Sometime if we increase, let's increase 2 more. You see, the fingers will change the position and he is not controlling anything, okay? So that's again part of the energy goes. 10?
Yes.
From the spine. Now we're going to open waist meridian. And here we would like to work a little bit more effectively. Let's do 12. How do you feel?
Oh, that feels good.
Good. Can I do one more?
Yep.
Okay, one more. So the waist meridian is like in a waist belt. It's a ring and the energy runs around the whole waistline. And if it's polluted, tight, and doesn't function, so digestive system, reproductive organs barely start to grow because there's no enough energy or agni to maintain the vitality in the body. And of course, the digestive system, it's in Eastern philosophy, it's a road of life. If it doesn't work, 90% of the body illnesses arise from indigestive problem. And this very simple look-like motions of hands that important to understand where your hands are and what they are doing. Okay? So I'm going to teach that as well. Breathe. How do you feel?
Good.
Good. Is your body get more relaxed, tension released?
Yeah, my digestive. I feel like I'm about to have a bowel movement.
No, seriously. More wider spine canal and actually stretch the spine itself. Increase, please. Paul, you would not feel tingling, but you will feel like a pressure goes over you. So we're going probably till 22. You breathe. You feel like heaviness goes over you, right? Just like a pressure goes over you. Deep breathing, 1 minute started. So what's happening right now? You see, between 2 of my palms, the energy more strongly and larger stream of the energy goes right through the spine and readjust even the position of the vertebra itself. Hello, welcome, doctor.
How are you?
We're doing great. We're missing you for this demonstration.
Is the ball on the table?
Yes.
Carry on.
Very good. So in 6 months, we can straighten up the scoliosis. No surgical procedure. So in 6 months, 8 months, we can dissolve intervertebral hernia by this very intensive irrigation of energy in the body liquids that caused by stagnation and stiffness. You see? So you can do a lot with the natural alternative method of cure instead of the surgical procedure with no invasive. And with done, it's a pleasant. Okay, go down, 18, 16 is good. So now I relocate the position of the hands. And again, please admire the simplicity of this whole method, right? Now my hands over the waist meridian, and we increase more, but it will be completely different
How are you
sensation
doing, Paul?
Good.
because
wanna
it's a
go
soft
again?
tissue.
Yep.
More?
Yes. Yep.
You tell me when.
He definitely wants to get rid of the constipation, by the way. Breathe in, good. Laugh is good. It's a positive emotion. 1 minute started.
Yes.
So it's like you put the gas in your tank, we put the energy back through the particular area, like here, fixation points. We refill the vitality through the portals or entrance that body gonna distribute as it is homework for everyday maintenance. As I said, we don't do anything artificial. We just enhance the process that was suppressed and become dysfunctional. Good. Go down. Very good. I'm going to do on your legs because it's a kind of protocol, but I'm going to adjust a little bit differently. You can.
Yeah.
Так, 12. Yeah. Okay. To open 6 paths on each leg.
I'm increasing.
Increase.
Paul, you let me know.
Oh, that's good on the legs.
You want more?
Yes, please. No.
Good. You see the legs are starting.
More?
Yeah.
Respond. Yeah.
That's
And he
22.
doesn't do anything. The inner body condition make this slight tweeting and tension that I can read it, or both client and the specialist dialoguing. 1 minute started?
Yeah.
Okay.
Okay.
When I don't feel well and I have a session, I don't cancel. Because through this synergy of giving treatment, I also receive it. Sometimes I have like slightly sore throat or little bit of the nose running after the therapy for the client. It heals me. And I have one of the video on our video site, and the girl saying, I enjoy so much through her training and practices, then she likes more to do it than receive it, because it's really great feelings. And you feel like you complete something very important, profound, I would say kind of mystical. Good? Go down.
12.
Excellent. Good. So you're saved. And now the last step, 420. 21. Okay, go ahead.
22.
Strong man. 22.
Very
Where
strong.
do you feel more? On the fingertips?
The fingertips and the elbows.
And the elbows,
I feel like
okay.
the joints of the elbows. Fingertips.
So there is a little of depositing in my observation, like a salt depositing into the joints. Do they make noise when you move it? Now going to the next station, right here. How do you feel? Feels good. So increase. Now you see it. So I'm gonna hold here for 30 seconds. He doesn't respond right away, you see? It's narrow paths. They are not fully opening. And I feel in a few seconds they will start to twitch. Oh yeah, they are starting now. You can get closer and look, you see?
Oh, yeah.
So they start to open up.
Yeah, I see a
And
twitch, yeah.
because the energy flow more, then the ligaments start to pull the muscles, and you see it. You see? Good job. You still alive? And now that's a very intriguing area. We're going to move to the next station of the acupuncture zone. So his hands going to move. Right, stretch it, relax. Good.
Increase.
Paul, would you like to increase a little bit?
Yep.
Increase.
Good. More.
Yep.
That's 20.
So, and again, I just keep the door open and the energy is floating out. That this bounce, he had some heat because of the liver, need to cleanse a little bit more effectively. And I felt the temperature elevated on the area of the liver and the stomach. There's some
Everybody's body is different, of course. So one client that we did where you saw where Paul's hands when he was on the table did like this. The other one went like this.
Yeah, that is the peripheral nerve system works slightly different. You see now, compulsing, yeah. Different way body adjusts itself. That's fine, it's not good or bad, it's just everyone is different, okay? Going to the next, the Swiss seed, Swiss apple seed that famous as stem cells,
Activator?
not activators, not the animal source, it's a plant-based source. Stem cells, plant-based source. So in some methods we apply that type of treatment before to have more effective results of the treatments. It also very nice warming up the body and gives very profound relaxation because all of our products made with this specific technology which is called sublimation, that basically what the technology opens the membrane and withdraw the nucleus, the molecules of the medicinal plants and higher mushrooms, and they have ability to go right to the body tissues, to the bloodstream, because they are too small and then can absorb even through the cell membranes and participate in a cell function. Okay, so we're applying now this moisturizing massage cream, and it give you little cooling sensation because it's basically blowed up water based, like emulgation with the herbal extracts. While we are distributing, would be need to pull down that. Christy, could you help me to open the sciatica points or the way we work? And a particular area where is the acupuncture zone and station to be activated. Yeah, also the right part, you see, it as well. And this is exactly lung, cardio, liver and stomach. Liver and stomach, right side, stagnation is not really pain, but liver does not really have a sharp pain. Liver, until it cirrhosis, does not give the sign of the dysfunction, but you have to pay attention because this is too much of the puffiness. How do we do with the tingling? Because I have to apply under the arm.
You're not ticklish, right, Paul?
Nope.
And I told him to remove the deodorant.
Very good.
Can you lift up the sheet too?
Yeah. How that feels?
Good.
Good. Actually, if you have dry skin and then you apply this moisturizing cream, you feel like you've been just bathed and have a nice refreshment. That's a very nice feeling. We use a lot of this cream even for the dry skin, just like a better quality natural moisturizer. Any of the medical practitioners, people here who practice any type of therapy, yeah? Yeah. No, I mean, I don't know if we have that type of audience I would be really interested to collaborate because we have so many outstanding health improvement. It would be nice to track from the both sides, from the PhD, like we did with Dr. Kevin, with a very brief overview what it was, even after and before and after the session. Okay.
You have a medical doctor here, Dr. Pamela Yatak, internal
Very nice,
medicine.
very nice.
She's retired. She left me dry, high and dry.
I'm delighted because most of Russian doctors and medical professionals join this opportunity because we have a lot of Eastern clinics, either Ayurvedic or traditional Chinese medicine centers, but they give you nice treatments. They treat you for wherever you need it very effectively. They don't teach you, right? They don't disclose that family knowledge or the practices they have doing with the clients. We do, and that's the big difference. Just we understand that if you need slide right here on the floor, and get closer to your feet. You can hold it. So these two we're going to apply on reflexology points, and we're going to change them. Okay.
Okay.
Now we're going to employ this time either water or the cream. We're going to employ water.
One more.
So apply both your hands, because here is the reflexology points. Simple way to do it. And those ones self-gluing patches. Open up a little. Oops. Hold them for a moment.
Do you need help?
Yeah, a little. You don't move.
Oh.
You don't move. Yeah. Good. So when everything is moving, then you get closer track. But now we need to put this in contact behind and plug the device.
Where?
Right behind. Right behind. You see them?
Yeah.
Okay. And we'll say beep. Good.
No. Oh, no.
So, and this we're going to apply exactly where Lee have indicated, right? One side, and look, they are self-gluing. Bones has a special type of material that attached. And they're washable because they're rubber ones. And even this, do this there. Bam, bam, done. Can be also done by yourself with the remote control. Start to feel like on your back.
Yeah.
You feel it?
Yeah, like
Yeah.
actually like a massage.
Yeah. So it's now 14. How do you feel? Can we increase?
Yeah.
1, 2, 3, 18. Sufficient. So what's going on right now? The stream of the energy runs from the plus to minus, and we check 2 minutes, right? So, and let the blood work through the pulmonary cycle, right? When we go down to the feet, it opens the big cycle, but the frequency and the sequence of we changing those patches will cover whole body blood circulation improvement.
I need that.
Yeah, exactly.
Yeah.
And what you do, you're sitting for 60 minutes in the house and you do it yourself, because if you take the remote control with the finger, you can work. I do with my toe, but different people, different things, right? So you do not need even the assistant when you know how the order works with your body.
Mm-hmm.
That's the simplest way of the therapy, and that's good for children, 5-6 years, and the elderly who are in a wheelchair and cannot really walk much. They cannot exercise. Here you are.
Mm-hmm.
Okay, 1 minute is gone. Okay.
Is it localized, or can you feel it anywhere else in your body?
No, I just feel it right there,
Just in
right now.
that area?
Mm-hmm.
Yeah, just feels like a pad and just lightly massaging.
Massaging it.
Yeah.
Now I'm gonna just for the test going to increase till 22. That you might start to feel in your palm sensation. Do you feel it?
My thumbs.
Yes, yes, yes.
Mm-hmm.
So the level with the frequency will be more effective with the gray patches, because they made the way in the way that they transmit the energy. So the acupuncture patches, they work slightly different. Okay, now what we do, we just go down and change it. What do we change? We change plus and minus. Release, release, booms, booms. Now what happens? The resonance changed. It's now go opposite, right?
Oh, cool.
Right, and go back the same. She will feel the same treatment on her
The back.
painful area. Mhm. Normally we do it 5 minutes. That fits 60 minutes.
Mm-hmm.
All outlets. For the demonstration, we do only 2 minutes for you just to see it. It's not the treatment, but however, she will receive the treatment, short term of the treatment, but she's gonna experience whole circulation path on both large and the small.
How you feel?
Good.
Yeah.
Mhm.
Yeah.
You just felt a change?
It's even give you more energy recharge. Sometimes when you feel like little down,
Mm-hmm.
let me do something like maybe even listen some news, right? And for 1 hour only, or 1 hour, you refill itself. I have a couple of videos, Smith, Pardesco, what's his first name? Barry Smith was very tired after work, and through the training program we did the presentation for the blood dispersal therapy, and we took the interview. How do you feel? I feel a little bit tired, but we're going to do this demonstration. And after 1 hour 60 minutes, he said, oh, now I feel rejuvenated. I feel more vitality to run. Okay, go
Maria,
down.
can I ask, does that feel different than the first time, or do they feel the same?